Hi everyone, my name is Tara Shore. I am a master's nursing student at Grand Canyon University. I'm going to discuss with you the nursing shortage and recruitment and retention strategies to use for your facility. I currently work in a small rural hospital in central Illinois. It's called Graham Health System. We have 50 beds, and even in a rural community we are still struggling to recruit nurses. By 2022, there will be more than 1 million registered nurse positions that need to be filled. A lot of these are to replace the baby boomers as they retire. Our population is aging. Along with that aging population, we're going to definitely require more nurses to care for our communities. There is competition between hospitals, and that's seen through advertising their services, awards, and certificates. This nursing shortage is going to be twice as large as the one back in the 1960s. Since I'm in Illinois, I did a little bit of research on that, and by 2020, Illinois will have a shortage of more than 21,000 nurses, and other bigger states will have a bigger shortage. AACN, or the American Association of Colleges of Nursing, is trying to bring awareness of the nursing shortage. They're working with media, lawmakers, schools, and nursing organizations. The nursing schools, which we have 2 nursing schools in our small town, and the bigger towns around us, they also have 3 nursing schools, but they're all seeing lower enrollment rates. And these lower enrollment rates are not putting out enough nurses for the projected needs of our patients. There's been ample research conducted statewide, government-wide, to show the impact the nursing shortage will have on our profession. Healthcare organizations really need to begin implementing new strategies to attract and retain nurses. Most organizations utilize an employee recruiter or a nurse recruiter to assist the human resource personnel in choosing the best candidates for an open position. Recruitment of employees does hinge upon how the organization presents itself, and it can present itself in job postings, marketing, and public relations. Healthcare facilities, most healthcare facilities offer quality health services, and along with the advancements in medicine, those facilities appeal to nurses and are the nurses' employers of choice because there are more educational opportunities, more research opportunities. To attract nurses, our public relations departments in said organizations need to really boast about the organization's accomplishments. We need to do something to attract nurses to work in smaller organizations. Avenues that they can use to accomplish this are through newspaper, social media, billboard ads, and through the organization's website. Nursing recruitment can start as early as high school. One of my suggestions is to utilize nurses from different specialties and have them attend a high school health class or job fair to discuss the profession and all the opportunities that it provides for both men and women. The National Student Nurses Association, they provide tools for hospitals and nursing schools to use in recruitment efforts. They do have a 10-minute video called Nursing the Ultimate Adventure, along with pamphlets that outline the advantages of going into the nursing profession. The video and pamphlet both focus on education, salary, benefits, and nursing licensure in each state. For Graham Health System, where I work, recruiting their nurses can be accomplished by making their presence known at the local colleges from the first day of class for a nursing student through graduation. Our nurse recruiter would be involved in college orientation for nursing students to promote our facility. On top of that, the nurse managers and our core team of nurses at Graham should have an open line of communication with the nursing school students and instructors throughout their program. That way they can analyze if that student can be a good fit for Graham upon graduation. Social networking is another tool that can be used. There are 1.2 billion people in the world who belong to a social networking site, and there continues to be growth in that. Employers can also utilize social networking to market their organization for a minimal cost or for free, like Facebook. They can also utilize it to become more familiar with a job candidate. By using LinkedIn, Facebook, and Twitter, this is our modern way for businesses and job candidates to network. Our impending nursing shortage will undoubtedly impact nurse staffing. For most nurses, they view this profession as a calling. I know I do. If a nurse doesn't feel that patient care and patient safety are a priority within their organization, they'll likely leave, creating a larger shortage within that organization. As a leader, you have to ask what motivates employees to stay. The answer is an employee who wants to be in a good working environment that is safe and promotes personal development, which is in line with most of the bigger hospitals. Not so much our small hospital, but the bigger hospitals, nurses are finding, that working environment and personal growth. Communication is a factor in retention of nurses. Most leaders feel that they're effective communicators and provide adequate communication to their employees. But the problem lies in the employee's perception of effective communication. We as leaders, we can always communicate more and better. For nurse retention, a method of communication that can be utilized is face-to-face. I think the leaders can perform rounds in each of their departments and gain a lot of information based on the climate of that department at the time they are doing rounds. While rounding, make an effort to reach every employee. This will help to immediately address any issues or questions the employee has. Evaluation of strategies that can be used for data collection and metrics could be as simple as just tracking the number of vacancies in the organization by department. Currently, we as leaders in my organization receive a spreadsheet of all the vacancies and vacancies at other local institutions on a weekly basis. I think that nurse turnover needs to be tracked and quantified for each manager in the organization at least once per quarter. If a nurse manager is having difficulty with retention, provide education for that nurse manager. And that's all. Thank you.